Pneumothorax. The collapsed lungs. What is pneumothorax? Pneumothorax is a collapsed lung. That happens when air leaks into the space between your lung and chest wall, causing the lung to collapse. This can be caused by a chest injury, lung disease, certain medical procedures, or sometimes for no known reason. Symptoms include sudden chest pain and difficulty breathing. What causes pneumothorax? It can be caused by many factors like trauma. A chest injury, whether blunt or penetrating, can cause a tear in the lung or chest wall, allowing air to escape into the pleural space. Lung disease. Certain conditions like asthma, emphysema, or COPD can cause small air sacs, blebs, in the lungs to rupture, thus releasing air. Medical procedures. Some medical procedures that involve the lungs or chest can cause a pneumothorax. Spontaneous. In some cases, a pneumothorax can occur without any obvious cause, especially in men between 20 and 40 who smoke. What are the symptoms of pneumothorax? Signs and symptoms of pneumothorax include sudden chest pain. The pain is often sharp, may worsen with each breath or cough, and can sometimes be felt in the shoulder. Shortness of breath. A feeling of breathlessness or difficulty breathing is a primary symptom. You may also notice rapid and shallow breathing or nasal flaring. Rapid heart rate. A fast or racing pulse is common as the body tries to compensate for the reduced oxygen. Now, let's discuss the types of pneumothorax. Pneumothorax can be categorized into three main types based on the cause. Primary spontaneous pneumothorax. It occurs in people without any underlying lung disease, and without an apparent cause. It is most common in tall, thin young men, and is strongly linked to smoking and family history. It usually results from the rupture of small, air-filled blisters, blebs or bulli, on the lung surface. Secondary spontaneous pneumothorax. It occurs as a complication of existing lung diseases that weaken the lung tissue, such as chronic obstructive pulmonary disease, COPD, emphysema, cystic fibrosis, asthma, tuberculosis, or pneumonia. It can also be caused by lung cancer or sarcoidosis. Traumatic pneumothorax. It is caused by blunt or penetrating injury to the chest wall or lung, such as a stab or gunshot wound, a rib fracture, or certain medical procedures like a lung biopsy or the insertion of a central line. There is also a very severe form of pneumothorax. A life-threatening form, tension pneumothorax, occurs when air enters the pleural space but cannot escape, causing pressure to build and compress the heart and the other lung. This is a medical emergency. Is a pneumothorax life-threatening? Yes, a pneumothorax can be life-threatening, especially in cases of tension pneumothorax, where pressure from trapped air can collapse the lung and compress the heart, leading to a dangerous drop in blood pressure. While minor cases may resolve on their own, large or recurrent collapses, especially in those with pre-existing lung diseases, can be fatal if not treated promptly. What is the best treatment for pneumothorax? The best treatment for pneumothorax depends on its severity, but typically involves procedures to remove air from the chest to re-expand the lung, such as needle aspiration, inserting a chest tube. For recurrent cases, a more definitive treatment like surgery or pleurodesis may be recommended. For a small, asymptomatic pneumothorax, observation alone may be sufficient as the air may reabsorb on its own.